Welcome to Medical Sales Live, the #1 resource for breaking into medical sales and building your career.
With us today, we have Dr. Christopher Mickler from Morton Plant Hospital and his representative from Stryker, Mr. Bryan Ahrens. So welcome, gentlemen.
Thank you. Thanks for having us.
Bryan, start with you. A couple questions on your background. First off, let's start with how you got where you are today. Tell us from A to Z how you got into this industry.
I got in this industry at approximately 2010. Fortunately, I had the opportunity to socialize with a lot of Stryker guys back in the day prior to joining Stryker. Fortunately, I have a relationship with Dr. Mickler, so when he was in residency, I would go visit and I would actually spend time with some of the Stryker guys, get them to know about the company and what it was all about. I've always been in sales. I have an IT background in sales. I used to work for Xerox Corporation for about approximately 8 years prior, and was a consultant for American Express and so on and so forth. So I've been in sales for quite some time, and I'm going on 12 years now with Stryker.
Wow.
Yes.
Interesting. So describe for me a typical life in the day of a spine rep, which is your career has been all in spine. Time you get up to when you eat lunch, if you eat lunch, and the time you go home. What would be a typical day and then / week that you would experience?
Okay, typical day would be, the objective and the goal is to be in the OR every day of the week. I would say that's a successful spine rep, is being in the OR every day. Unfortunately, we don't control that. It's based on the surgeon's OR schedule and when they do their surgeries. So the days that we're not in the OR, the goal is just to be meeting with surgeons in clinic, during clinic. And for me, what I try to do personally is I try to touch the surgeon both directly and indirectly every day of the week. And what I mean by that is directly, obviously seeing that surgeon, working with that surgeon, or meeting with that surgeon in clinic. And if I don't have the opportunity to do that, indirectly, I try to touch the OR staff that supports the surgeon, their staff at their office, just sort of some sort of indirect, relationship. Not relationship, but the contact with that surgeon is very, very important for me. And being out there and branding myself, that's the most important thing, is relationships that we have.
And Dr. Mickler, what are you looking for, and what value do you place on the competency, trust, reliability? Obviously, is a big thing, but in your words.
It's everything. I think that, having trust in someone makes the case go by quicker. When I'm driving to the hospital, knowledge that there's a rep who's going to be doing that case with me will have everything lined up to take stress off of me throughout the course of the day. That's pretty much, it makes my life a ton easier. And I think Bryan would probably agree that one of the jobs of a rep is to make the surgeon's life easier. And whether that means, helping me measure things in the operating room, getting the fluoroscopy set up properly, from a neurosurgical standpoint, I've got the case, but there's probably 9 other things going on in my mind about other patients in the hospital, and this just trust, competency, diligence, reliability. Those are 4 words that I think that all reps can really take to heart and try to strive to be.
Right, fantastic. Have you seen the evolution change over time? Like when you started, you've been the rep here for Dr. Mickler for 12 years now, almost his entire practice of 13 years. Have you seen a change over year or every 5 years, or has it been pretty much consistent, outside of, say, outside factors like COVID, obviously, it's thrown everybody a bit of a curveball?
I would say that hospital administration, the hospital administration is much more involved now. Dr. Mickler is hospital employed. I would think, in my opinion, that the hospital administration tries to get a little bit more involved with what he's doing from an instrumentation standpoint these days versus, back in the day, it's pretty much whatever he says would go, but that still happens today. I just think they're a lot more involved, the administration is, not only for the hospital employed surgeons, but also the private practice surgeons.
So last question I have is around new reps. What advice would you have, both of you, for a rep getting into this industry for the first time? They're in their first year. what are some do's and don'ts or things that you would say, listen, this is what you really need to focus on?
Yeah, sure. I mean, someone who typically has graduated from college, is in their early mid-20s, and wants to go into spine surgery and being a rep, I mean, I think one of the things that you have to understand is it's a big time commitment. And I think that sacrifice social life, sacrifice those Saturday nights that you want to go out and have fun may be compromised. It's a big commitment, but on the backside of things, it's also a very big reward because you get to interact with patients and have knowledge that these patients are going to do very well, establish relationships and grow your own practice are very big potential rewards for you down the line in terms of your career.
Bryan, final thoughts for new reps?
On that note, it's a lifestyle. It really is, and provided you're fortunate enough to get an opportunity in the industry, it's a lifestyle. It's not a 9-to-5 job. It's anything but a 9-to-5 job. I mean, you spend a lot of time with your clients. It's not a bad thing, but you do spend a lot of time with them, and you become very close with their families, and that's all you know for the most part. But on another note, though, is that, provided you get into the industry, don't be a yes man. It's the last thing you want to do is be a yes man. Be in the OR and be like, yes, 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 yes. You got to be honest with these guys. These guys are the upper echelon. I call them the top of the food chain. Your brain, cardio, vascular, and spine, top of the food chain. And you're working with very intelligent people. And you turn into that yes man, you'll be called out in a second. So it's all about knowing something, and if you don't know it, say you don't know it. Let me look that up and I'll get back to you on that, but don't be that yes person. That would be my advice.
And that takes time. I mean, that's not something that happens overnight or even within a year or two. I mean, as I said, as a surgeon, you gain trust in a rep based upon the way they absorb things. In their first 2 years, you should be a sponge to start learning the business.
Well, these are high pressure situations.
Sure.
You're operating on a live person, and in a lot of cases in this industry, in this specialty, it's life or death. So you need to know your stuff cold. And if you don't, to your point, Bryan, say you don't know the answer, but I'll get back to you in the next 24 hours.
Mm-hmm.
So,
exactly.
Fantastic. Well, I apprate you guys coming in.
Yeah. Well, thank you for having us, Rich.
All right,
Appreciate
thank
it.
you.
Thank you.
Thanks for tuning in to Medical Sales Live. Remember to like and subscribe to this channel for the latest in all things medical sales.